So here we have a top-down view of DHA. We mentioned that the IPO isn't the only game in town. Tom talked to you about the Joint Executive Committee. Well, when it comes to requirements and ideas, the IPO does fall under that organization, but in reality, the IPO answers to both the PEO for Defense Healthcare Management Systems, DHIMSS, and the VA Office of Information and Technology. DHIMSS is an important office. They're in charge with not only overseeing the IPO, but replacing DoD's legacy EHR systems and working with DHA on interoperability solutions. And Christopher Miller leads the PEO and reports directly to the number 3 official in DoD, the Undersecretary of Defense for Acquisition, Technology, and Logistics. My assessment is that the PEO was created in response to the role of the military health system, DHA's predecessor, in bungling the integrated EHR effort. We've seen the same thing happen in DoD, for instance, with the Joint Tactical Radio System being moved back and forth between the Army and Navy. I think it's highly likely that this PEO will eventually be inserted into DHA. So efforts to create the Defense Health Agency really took off in 2006 with Congress proposing a unified health command. But it wasn't until late 2013 that this vision became a reality. What took so long? Well, the problems with this plan are both operational and cultural. The services each have unique needs based on their expertise and how they fight. But despite these cultural differences in the service branches, DoD still wanted a new governance structure for the military healthcare system that would help slow down cost growth. And in the end, the services in the department as a whole largely got what they wanted. The services got to keep their commands. So as before, the Surgeon Generals of the Army and Air Force, for instance, report to their respective chiefs of staff, and the Navy Surgeon General reports to the Chief of Naval Operations, and so forth. But where there were redundancies across these separate medical commands is where DHA comes into play by combining, where possible, functions like purchasing, logistics, and IT. What DHA oversees then are those roles and responsibilities where it made sense not to duplicate effort. And it was more cost effective to bring them all under one roof, and these are called shared services.
So the goal of shared services is to free up dollars so that they can be shifted towards modernization and innovation. Now, when DHA was established last October, the functions that were highlighted in red on this slide were consolidated on day 1 into the agency, with the rest set to be consolidated by late 2015. Now, DHA's operating model consolidates all health IT operations, including IT management, infrastructure, and applications under one roof. Now, DHA hopes that by doing this, they're going to save between $250 and $300 million annually through this portfolio consolidation. To do that, they're looking at targeted investments in hardware, software, and services for both infrastructure consolidation and application rationalization.
So this is a bird's eye view of DHA's IT shop. Dave Bowen remains the CIO, but adds responsibility as director of the Health IT Directorate. This organization, as you can see, performs many important functions. The ones highlighted in green are the ones I'll talk about. There are more opportunities in offices such as information delivery, cybersecurity, and solution delivery. I'll start with the PEOs. Defense Health Clinical PEO sustains the current EHR suite of IT applications and systems, as well as oversees efforts to work with the VA to make sure medical data for service members transitioning to the VA is shared. They're also charged with making sure systems are in place so that DHA's capabilities are mirrored in the field. And this office is led by Paula Friedman. The Defense Health Services Systems, or DHSS, is the largest health IT acquisition shop for DHA. DHSS is responsible for over $250 million in annual IT investments and for tracking billions of dollars yearly in healthcare services. And this is where the agency's data stores are located, as well as medical coding, electronic healthcare reporting solutions, and various resource management tools. I'm sorry. Yes, Donald, I'll get it for you. It's in transition, so right now there's an acting director, and that's why I didn't mention it here, because tomorrow you're going to have a different name. So
And Dave Bowen's currently the CIO.
the overall
of the Health
CIO.
IT group. Dave Bowen.
Bowen, yeah. So I'll get you who the current acting director is for that PEO. Finally, infrastructure operations, formerly known as enterprise infrastructure, previously known as MCIS. It's not a PAO, but they're important in that they manage the overarching IT infrastructure and support services for all of DHA's centrally managed and automated information systems. As I said, the Health IT Directorate does so much more, but in the interest of time, I just wanted to highlight those offices.
So now we'd like to show you a snapshot of the overall IT activities for the VA. Now you can see steady growth for VA IT budgets, and that's not exactly the most common sight in the civilian space, but that's certainly good for those of us here today. Now, Romano Moschetti, he's the Deputy Assistant Secretary for IT Resource Management, and he's actually citing a figure that's a little bit lower than the $4 billion that you see here on the slide. He's quoting about $3.9 billion. And along with that, we're also seeing an increase in O&M spending and a obviously decrease in DME spending as a result of that. Likely, this is probably going to mean fewer new project starts in the coming year. Now, it's also worth noting that a little over $1 billion of this budget actually goes to pay government employees. Now, you're probably wondering why so much. Well, you don't just have the IT staff here in DC. You don't have the folks that are at the West Virginia data centers or the 4 IT centers in Quantico, Austin, Hines, or Philadelphia. You have the IT staff at over 150 medical centers and what is really, frankly, thousands of clinics and other VA facilities across the U.S. There are a lot of people that are actually working on IT systems across the country, and so with VA, it can be a little tough to figure out where it is that you want to go. Now, the VA loves to send vendors up to Eatontown. I'm sure they've all done it to you guys. So our goal here today is going to be to show you maybe a couple of different folks who are actually going to be willing to take your calls. Most of them are going to be down in this area, and folks that you can actually have a conversation with about how your products can better enable health IT.